The topic is pulmonary function test. It's difficult for anyone, but I will be very much exam oriented and I will be very much crispy in this case, in this topic. Now, before starting this graph, flow volume curve, I know it's very much confusing. I just want to tell 2 points. In the normal curve, in the x-axis, as we go to the right, the value increases. We all know it starts from 0, and as we go right, the value increases, and inspiration is above and expiration is below. This is a normal thing, but it is totally opposite in this graph. As we go towards the right, the value decreases, and as we go towards the left, the value increases. The volume increases because it is the volume, and as you go towards the right, the volume decreases. As you go towards the left, the volume increases, and the above is expiration and below is inspiration. So that you have to remember. Now you just again repeat the video, you will get to understand what I am telling. Now there are two types of disease we have to know. One is known as obstructive lung disease and other is known as restrictive lung disease. Now, what is the obstructive lung disease? What is the obstructive lung disease? In an obstructive lung disease, there is some obstruction. Now, inside the lung. Now, in the lung parenchyma, there is some obstruction. Now, what happens? The air smoothly enters because inspiration is a active process. So there are many factors. So inspiration is totally normal, there is no problem. But as expiration is a passive process and there is some obstruction, expiration takes time and expiratory efforts need much more effort. The expiratory volume gets increased because expiration takes a lot more time due to obstruction. So obstructive lung disease, I am drawing it in red. You will see it's a totally normal inspiration, but the expiration takes much more time. So this is the graph you will get in case of obstructive lung disease. Now come to the next one, that is restrictive lung disease. Now in case of restrictive lung disease, there are some restriction. Can be due to myasthenia gravis or pleural effusion or interstitial lung disease. I will come to it later. But in restrictive lung disease, there is less entry of air inside the lung. As less air entered into the lung, all the volume gets decreased. Whether it's a residual volume, whether it's a total lung capacity, every volume gets decreased. And so you can understand that. Now first of all, tell me, what is this point? This point is residual volume and this point is total lung capacity, because I told you already, because the right is less, the left is more. So total lung capacity in the left side, residual volume in the right side. And I told you in restrictive lung disease, every volume gets decreased. So it will go more right. Residual volume will go more right and total lung capacity also go more right. Because it's the opposite of the normal thing. And the graph will be smaller version of the normal. Because all the volume gets decreased. It's a restrictive lung disease. So you can see this red is your obstructive lung disease where there is a problem in the expiration, and this blue, the smaller version of normal shifting towards the right, is restrictive lung disease. You can remember R for restrictive, R for right shift. So now how will you differentiate by some parameter? Obstructive lung disease, total lung capacity, what will happen? There is no change because you are taking air normally. So it will be completely normal, or it may be sometime increase, but I don't want to tell about that. In case of residual volume, there is a air trapping. There may be a air trapping inside the obstructive lung disease because expiration is not normal. So residual volume might get normal or it can increase. FeV1, obviously it will decrease because I say there is a problem in expiration. Now this ratio, FeV1 by TLC, someone say FVC, but I will keep it simple, FeV1 by TLC, you can see it will decrease because FeV1 decreased, TLC normal, so it will get decreased. Get it? Now, in case of restrictive lung disease, TLC decreased, because I already said you every volume gets decreased. Residual volume decreased, FEV1 decreased, everything decreased, but this ratio, it becomes normal because TLC is decreased and also FEV1 is decreased. So this ratio is normal, and thus you can differentiate between OLD and RLD. Now, who are the example? It's very easy. Obstructive lung disease are asthma, bronchiolitis, and COPD. Whereas restrictive lung disease are interstitial lung disease. It can be due to pleural effusion, kyphoscoliosis, and myasthenia gravis. That's it. That's the obstructive lung disease and restrictive lung disease. Now come a point known as Mmfr, or mid expiratory flow rate. It's a most sensitive measurement for an early airflow obstruction. Early airflow obstruction, it is the most sensitive parameter, and it is seen in the small airway. So every point is important. Mmfr seen in the small airway to predict the early airflow obstruction. Now there is one more parameter known as DLCO. Now DLCO, the diffusion capacity of carbon monoxide, when it gets decreased and when it gets increased, that's we want to know. That's we want to know, when it gets decreased, when it gets increased. Now DLCO gets decreased in case of interstitial lung disease, in case of emphysema, where is destruction of the membrane, the alveolar membrane, in case of bronchiolitis obliterans, and like that. But DLCO gets increased, very important, in case of asthma. That's I want you to tell. DLCO gets decreased in case of interstitial lung disease, which is a restrictive lung disease, in case of emphysema, which is an obstructive lung disease, and in case of asthma, which is again an obstructive lung disease. So asthma, DLCO gets increased. You have to remember this. Other than that, in the heart failure, in the congestive heart failure also, the DLCO gets increased. Now the last two curve I want to tell. Last three curve. First of all, if there is a problem in inspiration and expiration both, what is this? This is an obstruction in the trachea. It's a tracheal obstruction. It's a tracheal stenosis, and you will call it what? It's fixed because it's during inspiration and expiration both. It's fixed upper way obstruction. It's fixed upper airway obstruction. If you see only the obstruction during the inspiratory phase, but the expiration is normal, so there is an inspiratory problem, so this is extrathoracic. Just you have to remember the ulta, otherwise you will be confused if you go to mode concept. It is extrathoracic obstruction, and if there is a flattening in case of expiration and inspiration is normal, this is again reverse. It is intrathoracic obstruction. That's I want to tell you that this pulmonary function test is totally reverse. I'm just again telling, if there is a flattening in the inspiration, it's extrathoracic, I for E, and if it's an expiratory flattening, it's an intrathoracic obstruction. If it's both, then it's a fixed obstruction like tracheal stenosis. That's I want to tell you. Just repeat the video 2 times. I think you can solve all the MCQs now. So that's it. Ball.